Greetings, this is the coronavirus COVID-19 update for 3/10/2020. And we start out with Baidu, as usual. Baidu is a Chinese search engine like Google, and they have a page dedicated to coronavirus stuff, information. Lower left, we have cumulative cases for today. Diagnosis 80,955, suspected cases 285. Both of those are up only 31 cases from yesterday, which is extremely low, if you can believe that. Cumulative cure 61,568, and that's what most people call recovery. China didn't cure 61,000 people. They cured themselves in 98% of the time. Existing severe cases 4,492. These are ICU cases, either a bad case of pneumonia or organ failure. And deaths up to 3,162 in mainland China. Then if you scroll down further, you see a single map, which is the one in the bottom center. I just put the last 2 days of maps up there. What China is doing here is showing the world how great they are, because this is the number of cumulative cases minus the cured cases minus the deaths. And you can see all the provinces of China are getting lighter and lighter colored. The scale is on the bottom left. So this is basically propaganda here, if you believe that. Then there's 3 graphs in the next, if you scroll down further. Two graphs are together and one is separated by a bunch of other data, so probably someday they'll put the 3 graphs together. So the first one just shows the trends. You can see that deaths are on a downward trend generally, and so are suspected and diagnosed cases on a pretty good downward trend, except for the last day. And cured or recovered is on an upward trend. Actually, it's kind of leveled off, but it's good to see 1,500 some people recovering every day. The next graph shows you Hubei province, and in the pink, and non-Hubei in the gold, and then all of China in the red. And you can see that Hubei basically follows the graph of China because of, Hubei being the epicenter. And that's where just about everything's going on in China now. They were separated on the left side of the graph, but now they're pretty much doing the same thing every day. And this is the new graph that popped up a few days ago, and this shows you domestic cases, which is the red line, which is going down every day, and then foreign cases going up drastically every day. And China gave this virus to the rest of the world. Now the rest of the world is going through the same stuff that China is going through, that China already went through. Then if you scroll down further, you can see a list of provinces, further meaning after the first 2 graphs. A list of provinces, and I sometimes just open this up under Hubei to see what's going on, but there's really, in Hubei, everything's in Wuhan. 13 new diagnosed cases, which is extremely low. And then nothing else, and no new diagnosed cases. Well, there are a few here. I read an article where out of, I think the Asian Straits Times, where they said that for the, 3rd day in a row, there were no new cases outside of Hubei. Doesn't look like that's true. Then if you scroll on further, you see a global map. This is not up to date. Johns Hopkins does a much better job, so we'll take a look at them. And then if you scroll down further, you see the last thing that I look at is the hot search today. So these are search terms that Chinese people use to find stories that they hear about, and they want to read about the stories. So sometimes the search terms don't make all that much sense. The first one does. President Xi visits Vulcan Hill Hospital. That is in Wuhan, and the rest of them we'll just take a look at. Okay, when I read about the story of him visiting this hospital, I went back and looked up the article on the right, which is where he committed 1,400 new medical staff to basically man this hospital. To, people that work in the hospital, I would imagine these are doctors and nurse and support staff and stuff like that. So this happened, I don't know, a week ago, and then today Xi actually showed up in Wuhan. That's his first visit to Wuhan. Of course, you don't see too many presidents. He's not really a president. He's a chairman of the Communist Central Party, but we call him a president sometimes. So this is his first time he visited the epicenter. And you don't see too many other presidents of other countries visiting the epicenter, so you can't blame him for not going there until now. And this is a new hospital, so there really wasn't much risk involved. Okay, this is kind of a funny story on the left. This is a family of 4 who actually were living at the epicenter in Wuhan. They were living in this fish market or seafood market. And if you saw the news early when China figured out where most of the cases first originated, this seafood market was blocked off and disinfected, numerous times with different methods. First, people going in there with, big sprayers, and then big foggers, and all kinds of different devices. And this family must have snuck back in there because probably they lived there. A lot of these markets, the area where you're selling your seafood and stuff is, right in front of the place you live. So a lot of people, lived in the row of buildings on either side of that seafood market. And these people snuck back in there and they were living there for 43 days. And somebody found them finally, and they all tested negative. Then the upper right, this was a hospital that was used for quarantine, and the hospital was over-inhabited, we'll say. I'm sorry, not a hospital, a hotel. And the hotel was only a few years old, and it met code. I don't know how it would meet code. I've traveled for a living all my life, and I've never been in a hotel where I got the feeling that it would collapse if there were too many people in the hotel. But that's what happened in China. Buildings collapse in China sometimes. So this collapsed with a lot of people in it, and these firefighters are starting to dig through the rubble and find people, and that's why there was an article about them crying at the scene of the collapse. On the lower right, Xinjiang is a city in Hubei province, and it has been selected to be the first city that will get back to normal. But that's not quite yet. But they'll drop all the quarantine rules, the isolation rules, and let people roam around. I guess the city's pretty much under control, but they're not ready to do that yet. They just announced that it would be the first city in the province to return to normal. Then on the upper left, this is basically international news. So we'll cover this later, but a group of 27 people in a Seoul office building in South Korea were found to have coronavirus. So we'll find out later that they're actually, taking a really good look at this. This was a call center. There's other places that were dance studios. We'll take a look at that when we look under South Korea news. And then on the right, this translates every single time to 14 Square Cabin Hospital. So think of Square Cabin, which I guess is the literal translation, as like a makeshift hospital. These were like, arenas, and, this looks like a basketball court here, gymnasium, whatever they could find to set up a zillion cots and have a makeshift hospital. So all 14 of them are being closed now, which in Wuhan. So that's good news. That means that they don't need them anymore. And what do we have? Western news about China. Beijing objects to the term Wuhan coronavirus and says it may not have originated in China. Right, it didn't. It may not have originated in the seafood market. It may have come out of a laboratory. Coronavirus lessons from China. There's a lot of lessons to be learned from China, both what they did wrong and what they're doing right. But the United States hasn't learned how to, learn anything from these lessons yet. China has new local COVID-19 case outside Hubei, or no new cases outside of Hubei for the third day. Yeah, that came out today, but that isn't true, looking at the data. But, the rest of the provinces in China are really, really low. Then we take a look at this every day. This is the Johns Hopkins, and I used to put the name of the research institute up there, and now they added it in and dropped off Johns Hopkins. But this is the Center for Systems Science and Engineering. It's a research institute at Johns Hopkins University, and this is the global tracker. So what we have now, or when I took this snapshot anyway, is 118,582 cases with 4,262 deaths globally. So the first thing I look at with this Johns Hopkins stuff is I compare it with the Chinese number. So China, they finalize their numbers around by 10 o'clock in the morning, usually around 8 or 9 o'clock in the morning, which would be 8 or 9 o'clock p.m. our time, Eastern time zone, United States. So they have 80,955, and we're showing mainland China's 80,757, so we're off a couple hundred there. So you would have to add that to the total confirmed to get the right number, but it's relatively close. Sometimes it's off several hundred and makes a big difference. So then I take a look at the three hotspots outside of China, and really these are the three global hotspots right now with several thousand cases. First, Italy went from 9,172 to 10,149. It's a pretty sizable increase. South Korea, 7,478 to 7,513. That's a very small increase. Looks like Korea is getting things under control a little bit. And then Iran from 7161 to 8042. You can see that Johns Hopkins changed the names of some of these countries from South Korea to the Republic of Korea, not to be confused with the Democratic Republic of Korea, which is crazy land, and Iran to the Islamic Republic of Iran. And on the right, you can see I've highlighted the deaths. So Italy still has an outrageously big number of deaths, 631 deaths. And Iran, 291. That's probably not accurate. It's probably a lot more than that. And 54 deaths in the Republic of Korea, or South Korea. And then I look for stories to try to figure out what's going on. So yesterday, Italy announced that not only Lombardy province up north would be under quarantine, under lockdown, the whole country would. So this is the first day after the whole country was locked down, and a really, really drastic increase here. So hopefully that'll die down a little bit. They're prohibiting people from moving around. You can see on the lower left they're disinfecting a museum. And Italy records highest single toll from coronavirus. 631 died, or I'm sorry, 168 died to bring a total of 631. And then the article on the right, Italy's coronavirus crisis could be America's. We're heading there because we have nobody in the country that knows what they're doing. News out of Iran, aside from the huge, the number of deaths up to 291 now and crossing over the 8,000 mark in the number of infected people. On the right, this is lower down. It wasn't the same story, but I found it anyway. Iran's Revolutionary Guard, the police, and the Iranian military have imposed a closure of the holy city of Qom. So this is now they've put, they've chained the gates and said nobody in. So this is where the outbreak started, in this religious city, because it was a religious pilgrimage. There's a lot of pilgrimages for religions all across the world. But that's what started this, is somebody, who was infected, that came from another country probably, came into this pilgrimage, and these people are all staying at the same hostels, sleeping right next to each other, and on top of each other in bunks, and eating in the same place, and going to the bathroom in the same place, and just packed together. Plus the shrine itself is kind of crowded. So that's how this all started. And on the lower right, we have medical staff are now declared martyrs, the people who died. And that's the news out of Iran today. News out of South Korea. And this is the South China Morning Post with the middle picture here. So officials attribute the decrease, because the numbers are way down, 74.78 to 75.13. That's the number. That's the increase for today. They attribute the decrease to mass testing, improved public communication, and the use of advanced technology. Mass testing. That's something that the United States wasn't doing, and that's why things are out of hand in the United States, and that's why the United States is going to look like Italy pretty soon. On the upper right, you see pictures just about every day of the South Korean army, or their reserves or whatever. They're going through the streets and disinfecting everything they see. Sidewalks. You don't know how effective disinfecting sidewalks is, because not too many people, put their hands on the sidewalk and then cough, but just seeing them out there is good. It's good for the people to see. And then what do we have? This is. I finally looked this up. I get a lot of news from this Channel News Asia, and just today I wondered, what channel are they talking about? Because I've lived in Asia and I've worked all over Asia, and I was just wondering, what channel are they talking about down here? And I'm thinking of water. But Channel News Asia is, if you look at the bottom right picture, there's different channels, like TV channels for every country. So it's just a conglomeration of a bunch of channels, not water channels. And then we have 3 other countries, France, Germany, and Spain, who are all kind of out of control. France from 1,200 to 1,700 cases, almost 1,800. Germany 1,176 to 1,457. And Spain 1,073 to 1,695, almost 1,700 cases. That's a pretty good size increase. So what do we have? This, I depend on news sites that, like this France 24 on the upper left, and like in Germany, the World, Welt, and the Mir, big, big publications, big channels, big newspapers in France and Germany and Spain. And it just surprises me how many days you don't see any news about their own country. Like this France 24, every news story in there about coronavirus is other countries. Even though France, went from 1,209 cases to 1,784. No news about that, though. Fear stalks the empty streets in France's COVID-19 hotspot. You can see the streets are empty in one city, but that doesn't mean the infections have stopped. France had to tell citizens cocaine won't cure coronavirus. This was something that was spreading around as a rumor, and France had to come out and say, no, cocaine doesn't help. And in another piece of news, just airport's director tests positive for coronavirus. Probably a lot of airport people are testing positive for coronavirus. And then what do we have? Spain. Spain adopts new measures. And on the bottom here in the details, you can see the wine producing region. They become hot spots. All public schools and universities will shut their doors in these regions. Public gatherings of over 1,000 people will also be forbidden. We should be doing this stuff too. Spain sets up anti-coronavirus plan to avoid Italian scenario. So Spain claims that all their initial cases came from Italy. And, it really spread fast in Spain. I mean, Spain and Italy are pretty far apart. But, things just went unchecked in Spain. And, they've been, I mean, look at their numbers. They went from nowhere to, 1,000 to, 1,700 now. And then we have news out of Germany. And actually, we have news coming from Germany about Germany, which is, this on the left, the Welt is the world. How is coronavirus affecting life in Germany? They actually finally have some stories about Germany. But Business Insider is the one that picked up this thing about Merkel. Merkel estimates that 60 to 70% of the German population will contract the coronavirus, which, made everybody, I mean, she said that, in a political meeting, and, everybody in the room shut up. Not just a meeting, I mean, something like the Senate chamber, a big room full of people. And, that's possible. Germany pledges $1 billion euros to tackle the outbreak. A story on the right coming from, that's the world. Then we have the United States, and the United States is out of hand. Why? Because the CDC is an organization that should be dictating what's going on in the country, and they have no clue what they're doing. They smoke crack all day and don't do anything. So from 3/9, the cases are up from 605 to 971 today on the 10th. Deaths up from 22 to 28. And you can see our hotspots are the same. Seattle, 2 different counties in Seattle, one having the bulk of it, but 2 major counties, San Francisco, Los Angeles, and New York. And, it shouldn't be any big surprise, that these cities are the epicenters. Because why? Because the initial cases are people who visited Wuhan. And all of these cities have heavy Asian populations, heavy Chinese populations. Should have been a plan in place. Why? Because look at the other viruses that have come from China. You would think somebody like the CDC would think, hey, maybe we should get prepared and have big test centers in these cities with large Chinese populations. But no. And Toronto's in the same position, only I don't see their bubble on here today for some reason. Usually when they click on the United States, you see a big red circle around Toronto too. I guess they just moved that to Ontario, the province, instead. But a couple days ago, it was on Toronto. So what's going on in the U.S.? New rules announced for nursing homes, assisted living facilities. And those new rules are screening for visitors. That's a good choice. Employees and volunteers also be screened for each shift. Now, this is partially crazy. You would think the CDC, before coronavirus even popped up, would say, hey, there was something on the ABC nightly news just a couple days ago where, 1 million people for every 1 million people in these nursing homes, assisted living places for older people, 380,000 of them die. Okay, now, if you look down the list of the CDC or any hospitals list of the major causes of deaths in the United States, heart failure is number 1, but, pneumonia is like number 7, and respiratory failure is like number 4. So, the reason that so many people die, old people in this country, by the millions, I mean, when people get old, their immune system isn't that good, and their body can be ravaged, organ failures and pneumonia and stuff like that. But all it takes is some kind of flu to make them, to kill them. And now we're finally waiting till coronavirus comes around, when we're not anywhere near as many people have died of coronavirus as people have died from the flu, old people in nursing homes. But now we're doing something about it. And, that's just that's just actually, the county doing stuff. The CDC isn't mandating this stuff. Nothing's coming centrally out of the CDC because they smoke crack all day. I could replace these people tomorrow and the country would be a better place. Coronavirus cancellations begin to amount as, as the sports world reacts. So nobody really knows what's going to be going on here. You're going to have the NBA playoffs starting pretty soon, and March Madness and baseball season, and the country might just stop gatherings of large crowds of people. So that'll be interesting to see what happens. Sacramento County gives up on automatic 14-day quarantines. So here the reason they're giving up is they found it impossible, and instead they're going to focus on lessening the impact of COVID-19 instead of worrying about tracking people and trying to quarantine people. Okay, more news out of the U.S. I try to look for some stories that aren't in the evening news every night. Lower left, Channel News Asia again. After testing delays, U.S. coronavirus cases surge past 900. See, the rest of the world notices, testing delays. They know what the problem is in the United States. It's the CDC. It took them so long to get their act together. It's just unbelievable it took so long. Outrageous Harvard gives students 5 days to leave campus. A lot of students are complaining because they can't go home in such short notice, and they don't have internet access off campus, which is crazy. Why would you not have internet access where you live? It's nice that you study on campus, but hey, there's other reasons for a campus to close, like shootings. You should have internet access where you live. Upper right, New York deploys National Guard troops. Well, it's about time. They can do that, but that could also be done on a national basis, by somebody like the CDC recommending, hey, at this stage we need to get the National Guard in. And then the last thing is a graph I just started yesterday, because there is no graph to show you what's going on in the United States. So we started to level off yesterday, 547 to 607, and then all of a sudden it's way up there again. That's all we have. Thank you.